In the past year, the people you see here had medical emergencies requiring a trip to the ER. In Bill Wing's case, it was his heart.
I had chest pains.
Deanna Vasquez's primary care doctor rushed her to the hospital.
I had an allergic reaction to a prescription drug she provided.
And with Abigail Penguia, it was pneumonia.
They gave me an IV, gave me fluids, aspirin. I got a CAT scan.
Medically, all three are okay now, but each is still recovering from surprise bills sent by ER doctors.
I was billed $600, of which only $27.50 was paid by my insurance.
I think about $1,006 or something.
And I was in the ER for a couple hours and I got billed for almost $2,000.
You don't have to have a medical emergency and then a financial emergency right after it.
That's Stacey Pogue. She says surprise billing happens when a person with health insurance goes to an in-network emergency room for care, but the treating physician, radiologist, or anesthesiologist is out of network, and as a result, that person gets an unexpected doctor bill insurance won't cover.
I've seen some that are well over $1,000, and I've heard about ones that are, $2,000 or more.
Pogue is the senior policy analyst for the Center for Public Policy Priorities, a nonpartisan think tank in Austin. She recently studied the problem in Texas.
It's just a roll of the dice.
According to Pogue's research, when it comes to the three largest insurers in Texas, between 41 and 68% of their policyholders getting ER treatment in 2013 got hit with surprise bills. Now, that's exactly what happened to Bill, Deanna, and Abigail.
The hospitals you went to, you all checked in advance that was in network.
That's correct,
yes.
yeah.
Mm-hmm.
And did anyone in that hospital ER tell you the doctor you were going to see was out of network?
No.
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 Flooded with stories like these, we planned on going to Austin and showing these interviews to lawmakers and pushing for change. Turns out, our reports plus stories in the New York Times and on National Public Radio already made their way to Austin. And now groups like the Center for Public Policy and the AARP are using these reports to lobby against surprise billing. Do you think the media making this issue more prevalent has helped?
I know it's helped. I've heard that in meetings at the Capitol.
Pogue says two bills are now making their way through the Capitol. Representative John Smithy filed the first one, and his bill would basically end the practice of surprise billing ER patients in Texas.
There are actually doctors and providers who profit from this.
Smithy explains right now, under Texas law, patients can appeal surprise bills and try to negotiate a lower price tag. But it's a non-binding mediation process only available if the tab tops $1,000.
Right now, one of the problems we're seeing is that a lot of these balance bills tend to be in the $950 to $1,000 range. They come in just under $1,000, likely intentionally to avoid the mediation process.
For that reason, Pogue says Smithy's bill simply takes patients totally out of the dispute process.
They don't get the surprise medical bill, it's not sent to them. And if the doctor doesn't think the insurance company paid a fair price, the doctor and the insurance company can go to mediation, and they can duke it out there.
While Smithy feels his bill is on the fast track to becoming law,
We've got, I think, a reasonable chance of success this session.
it's too late to help these folks.
I ended up paying it when I probably shouldn't have.
But they're glad lawmakers are taking action, all three saying if nothing happens, the problem with surprise billing will only get worse.
I think we are all going to be more susceptible to these type of costs going into emergency rooms.